So Dr. Luc, if someone comes to a classical homeopath to get depression treated, but they're already taking antidepressants, so we know with some pharmaceutical medications and antidepressants, one of them, that you cannot come off them straight away, hey?
No.
So can homeopathic treatment still work if someone's at the beginning of it still taking a pharmaceutical medicine? How do you approach that scenario?
Yeah.
If a person comes to you with depression but they're already on antidepressants?
And indeed that's a good question, because some people who would watch this would say, well, I can't really stop my drugs, I'm too afraid to do this kind of thing, you know, which is understandable, even after I say it's a placebo effect. But also, did I say too, when you stop the drug right away, you're going to have withdrawal symptoms, and that's also not the thing to do. So no doubt about it, I always say to my students, you cannot stop. It's the same for asthma. Now we talk about depression now. You don't stop the drugs that you are taking. It's not necessary.
Sure.
In other words, when you give the right remedy, the homeopathic remedy can indeed still have the effect that you want to see. You know, so we can clearly see that we see where the patient is when he comes to you on the drugs. And then we give the remedy. Let's say a month later, we see where the patient is, and the patient did not change their drugs, and he is improved, then we know logically it is due to the remedy, obviously, right? Because if we do two changes at the same time, we lose the effectiveness of our reasoning here. So one change only, which means not you stay all the same, whatever drug they are taking, you keep on taking, and we will see how you react to the remedy then, because we know for sure it's the effect of the remedy. Only then, when you see that the remedy has taken, so to speak, will we not totally stop the depressive medication or anti-asthmatic medications. We'll bring them down in, you know, in amount, the amount we're taking, maybe the potency that is taken. If you're not a doctor, as a homeopath, you can always hopefully work together with a master medical doctor, if that's possible. And that would be by far be preferable. And otherwise, like I said, we can clearly see. So the nice thing is homeopathy will still work while the patient is on a drug. You know, it still will work. It still even will work better as we decrease the amount of Western medical drugs and as we go on with remedy.
So in other words, if someone starts with depression, starts to improve with homeopathic treatment, they can go back to their doctor who put them on the antidepressants and bit by bit work off them, because their need for them gets less and less. Is that correct? Indeed,
and you know, and obviously, hopefully, that is before many side effects of the drugs have even manifested themselves. So again, too, if the physician, hopefully the Western medical physician who gets his patient back, will look at it in the right way and just accept that indeed the patient is better. And just will try, I think any doctor probably would do it, will try say, let's see what you do, how you do on the lower dose of the medical drug, and continue, of course, with what you're doing. So that probably would be the right thing to do, even if he thinks too that what the patient is doing is a placebo effect. But we already talked about that, you know, the drug is also a placebo effect.
So do homeopathic medicines and pharmaceutical medicines interact with each other? Is it safe to take a homeopathic medicine while you're on a pharmaceutical medicine? Will it interfere with the pharmaceutical medicine?
Yeah, that's a question often asked, of course, especially when we think about serious diseases, like I said, that even doctors, regular doctors who don't really know anything about homeopathy, might be afraid of such thing, right? Oh, but it might stop the action of the drug that I'm giving to you, even like in cancer treatments and things like this. Now, that's not the case, of course, although the principle is completely different, the homeopathic remedies. If anything, it brings the vital force up. It can create, like, let's give an example, like eczema. That's even an easier example, where, you know, obviously what do we do with that? With the drugs, cortisone usually, we suppress actually the skin, so we drive it deeper in, you know, we often create asthma. Well, obviously when we do the right thing, which is bring a disease out, we'll bring those symptoms back with the homeopathic remedy, but that's not aggravating, that's really trying to treat the patient in the right direction of cure.
All right. So pharmaceutical medicines, because they're a physical medicine, don't interact with homeopathic medicines because they're energy medicines, is that correct?
Yes, that's correct.
Okay. So the World Health Organization, WHO, in the past, have called for closer incorporation of homeopathy into the Western medical approach. So you travel around the world a lot through your work. Does that happen in the world in different places, and in what way, and could you give some examples of where that's happening?
Yeah, this obviously the World Health Organization did the right thing to really bring this up, but of course the reality, how far had this an effect or a result? You know, it is probably having the most result in very poor countries. I travel in third world countries too, okay. Where people do not have any availability to drugs, they don't have any money, which is probably the good part in a certain sense. So there is more a tendency that this can be introduced. You know, this is really part of my work, that really it would be available to the poor. You know, so
it's
many.
Relatively inexpensive.
It is very inexpensive, right? Yeah. Very. It's also very easy to get to the people, logistic-wise. Okay, we don't need to have tons of medications and airplanes full of medications. We can carry our little box with us, and we can walk to the, you know, just like the barefoot doctors in traditional Chinese medicine did in their time. So that's probably easier. So where is it? So in effect, therefore, and it would be great, and even more great, if it would be accepted in countries where half of the population is so poor that they never can afford, you know, medical treatment. I think about Africa. I think about even China. I think about India. And so indeed, on the place where it really had the most effect is some place like India, for sure. Right? I think how they have positioned themselves with homeopathy is probably the best in the world. Not always the best education, but really how they are supported by the government is probably the best, because they have excellent schools. I mean, they have great universities, beautiful buildings, you know, that you can say, put them next to the medical buildings and this could be compared. They have ambulances where, in fact, where the students are gone to villages to go and treat people. So right there, the most, definitely the future is there the best so far. Still many things have to change. Is it all of the rest of the world? Really, that call has not been answered that much, because interesting, the more money people have, the more the civilization takes place. Actually, the more people want drugs. Even where I saw it in China, I saw it in India, that the moment they have some money, like in the big cities, that it becomes a prestige almost, you know, to go to the doctor, the Western medical doctor, rather than following their traditional Chinese medicine or even homeopathy, like in India. So it's unfortunately that people think the wrong way, that, you know, it's a wonderful thing, because if I can go to a Western medical doctor, it means I am from a higher standing, I have more money. So it has nothing to do really with healing. It has more to do with prestige.
But in Europe, for example, there are many homeopaths in Europe are medical doctors as well, aren't they? And there are medical doctors. I remember reading a statistic that 40% of UK doctors will at times prescribe homeopathic medicines rather than pharmaceutical medicines.
Yeah.
So.
Well, you call like the UK, obviously, because their kings and the royal family is always a proponent of homeopathy. So, you know, but nevertheless, even just recently, homeopathy gets attacked in the UK. You know, first, you know, articles in Nature, then, you know, within, you know, some article, you know, some particular program on the BBC, and usual, you know, it's really based totally on wrong facts. And of course, as usual, what happens is that, you know, the journalists, you know, the media, always bring those wrong facts first up, because it brings public the attention. You know, it makes listeners and it makes readers. Okay, so with a big blur, homeopathy doesn't work. It's all bogus, and so on and so on. It's just a placebo. And then, of course, if they have to retract it, they do it a month later, but nobody reads it anymore. You know, it's just like Jonathan Swift said. You know, it's very easy to plant that kind of seed. You know, and then when the truth comes, then nobody listens to the truth anymore. It already is old news. That doesn't really make really many listeners. And that's unfortunately how everything is going in that sense.
Okay. So, Dr. Luc, just to finish, if people watching are interested to learn more or to read more about treating depression with homeopathy, where could they access more information?
Well, I would always if they can get to a homeopath, I always ask them to really talk to a homeopath, obviously. But there's many articles about it. There are some free articles actually on my website too, drluc.com. Read a book about homeopathy, try to see if it makes sense, because as we said, depression, whatever we discussed today, can be equally well for other disease names. Okay,
Sure.
This is just a disease name,
Sure.
but certainly this is a great tragedy that the kind of depression, the incidence of depression is very high. So I would probably say, try to acquaint yourself. There is enough on the internet, thank God for the media in that way, that we can investigate and really listen to it and try to educate ourselves. After all, nobody cares more about you than yourself. And I think that should be the first rule.
Okay, Dr. Luc, thank you very much for your time
You're welcome.
today.
And hopefully many people benefit from it.
Thank you.